going to talk is going to be a bit different, which you have not heard from the other speakers. So the key So this is going to be the digital revolution which is going to happen in the near future. In this connection, I would like to highlight about what our government has done so far. We are much forward in the digitalization of the hospitals and using the digital data for artificial intelligence. So I don't know how many of you have visited the website of Ayushman Bharat Digital Mission. Please visit the website of Ayushman Bharat Digital Mission, which aims to develop the backbone necessary to support the integrated digital health infrastructure for our country. It will definitely bridge the existing gap amongst the different stakeholders of healthcare ecosystem through digital highways. So, how they are doing?
Ma'am, please continue. Ma'am, you can continue. Ma'am, you can hear us?
Yes, I can hear.
Please continue, ma'am.
This is an audio recorded slide. Is it audible?
No.
Hello. That was a audio recorded slide. I hope it was audible.
No, ma'am, it was not audible.
Oh, it was not audible. That's why I was listening. Okay. So let me explain in
Play
detail.
it again.
Yeah, no, that audio will come. So it will be overlapping. I will explain in detail.
Oh,
So the health professionals repository is there. And I do not know how many of you have registered with this health care professionals repository. How many of you are registered? Do you all have your HPR number? Can I get the feedback? Anybody has got HPR number?
I think it is no.
No.
Everybody
So
saying.
please visit the website of Ayushman Bharat Digital Mission, and today itself please enroll yourself as a health professional. Doctors and nurses can enroll themselves as health professionals, and enrolling as health professionals is very, very essential because that will give the data to the government where we are working. They can use the GIS system, that is Geographical Information System, to locate where we are, and in case of disasters, in case of emergencies, they can contact us and they can integrate the care. Not only that, that will be helpful to integrate the care between primary, secondary, and tertiary care facilities. For example, a patient coming to oncology unit gets discharged and he requires palliative care and hospice care. If we are enrolling ourselves, then the system can locate who are all the nurses available next to his house, and we can link them so that the continuity of care can be promoted. So these kind of systems are has to be worked out, how we are going to use the data of health professionals, availability of health professionals based on their location, and how to integrate primary, secondary, and tertiary care. So with the help of artificial intelligence, this can be done. That is why our government has taken the initiative through Ayushman Bharat Digital Mission to register all healthcare professionals. So we have to first of all register ourselves. Please register today itself. And you can also upload all your certificates there. I have enrolled myself, and there is a number which is given, and you can upload all your educational qualification, experience certificate. So it will be like a digi locker for you. Whenever you want, you can retrieve your own certificates even if it is lost. So this is something similar to our NUID, National ID, which has been created by Indian Nursing Council. But this data will be with Ayushman Bharat Digital Mission, and they will be able to connect us with the team wherever and whenever required. So this is one of our important responsibility to register ourselves under the health professionals registry of Ayushman Bharat Digital Mission. And this ABA mobile app is also available. This is the electronic health record of health related information of an individual that conforms to nationally recognized interoperability standards, and that can be drawn from multiple sources while being managed, shared, and controlled by the individual. The most salient feature of this patient health record is that it distinguishes it from electronic medical record or electronic health record. So we have to understand the difference here: patient health record, electronic medical record, and electronic health record. EMR and EHR will be with the hospitals, whereas this patient health record, the patient can access wherever he is and whichever hospital he is visiting. Portability is there, interoperability is there. So whichever health facility the patient is visiting, that particular facility will be able to access all his data, or he will be able to show his data. So this ABA mobile app is also being widely encouraged to be used. And health facility registry, every hospital is expected to be registered with Ayushman Bharat Digital Mission now. So they are creating a kind of a unified health interface. All the hospitals, clinics, diagnostic laboratories, imaging centers, pharmacies are all expected to be enrolled with the health facility registry. So this will create the digital health ecosystem, and we will be able to map the resources and link the healthcare team members. So all the hospitals are expected to register register even for their insurance claims and for getting Ayushman Bharat reimbursements. They are supposed to register themselves and get a HFR number. And this is such a simple process, and hospitals have to be informed and encouraged to register under the health facility registry. Then only the artificial intelligence could be used, because for artificial intelligence, the foundation is data. We need to have data. Then only the data is visualized, analyzed and integrated for better performance. So to provide the data, first of all, we have to be connected with the digital platform. We have to register ourselves with a digital platform. That is what our government has taken the initiative, and all the health facilities are expected to be registered. I think majority of them are getting registered now, irrespective of whether they belong to government or private, or it is a clinic or a secondary care hospital or a small nursing home or pharmacy. All of them are expected to be registered under this health facility registry, so that when there is a ABA app, the patient health records can be accessed and ABA account is created. So that ABA account will be linked with the UHID of the patients, whichever hospital they are visiting. With this help, the health professionals also get registered, the health facility also get registered. So it creates a kind of a unified health interface, UHI, and this will be helpful to network between the hospitals, network between the healthcare providers, and the patients can port their healthcare requirement to any hospital. And so all these things are possible, so that they can do their appointment booking, teleconsultation and service discovery and others very easily. For example, an antenatal woman gets registered in her husband's place and she gets delivered in her mother's place. If she is registered with the Ayushman Bharat Digital Mission and ABA account is created, and if it is linked with her UHID, then wherever she goes, the care will be given and the continuity of the care will be maintained. Similarly, the patients might come for preoperative care and get operated, get discharged. For post-operative care, they need not visit again the hospital which is far away from their houses. They can go to the nearby facility and they can use the ABA account to access the medical records, and the medical professionals, nursing professionals can access. It can be used very easily. So this is how the interfacing is being envisioned by our country. So as responsible healthcare professionals, we have to register ourselves as under the health professionals registry. We must make sure that our hospital is registered under the health facilities registration, and we must have the provision for all the patients to create an ABA account. It is such a simple process. All of us have to have two accounts. We also have to have a ABA account, because though we are health professionals, we also might require medical care. So when we go for admission, this ABA account will be required. It is a very simple process. With 2-3 clicks it can be created. It is linked to Aadhaar number. So these are all the basic responsibilities as a citizen and as a healthcare professional we have to do, so that we will be able to. So this is the RPM system. So in the RPM, remote patient monitoring system, you can see the patient's activity level, blood sugar, heart rhythm, heart rate, oxygen saturation, and pain scales. And this information gets stored and it is available for reference by the medical professionals to review. So this is how the RPM system works. That is the collection, transmission, storage, which is available for review. So now I would like to, my session is AI, hands-on AI, still I am unable to memorize the topic which is given to me. So practically how it is applicable, I would like to share one of the success story of an organization which is known as Janitri. So this Janitri has got the remote patient monitoring devices. Especially they have created for remote monitoring of the mothers. How they have done is, one of their product is KR Echo. This is a smart handheld fetal Doppler. So the mothers will be able to monitor the fetal heart rate, and the data will be transmitted to the healthcare provider, and they can take the advice, and they will be taught how to identify the deviations and when to seek emergency care. And how to promote fetal health. So this is available for the mothers. And another one is home NST, non-stress test, how the fetal heart rate increases in response to the fetal movement is measured in non-stress test. It is required for high-risk mothers, especially where the fetal health might be compromised. So usually